My name is Shelby Kinsey, and I'm an ALS patient who has had to fight for my right to receive a life-preserving drug, and I'm not the only one. When we were first denied, we were told it was due to Blue Cross Blue Shield of Texas deeming Qalsody medically unnecessary. We ended up appealing the decision 3 times. By the last denial, we had caught the attention of the Senior Vice President of Policy and Advocacy with the ALS Association, who started to reach out to senators and other legislative bodies. Thankfully, the next decision we received was an approval, and I was able to start Qalsody. It honestly shocked me how difficult the process was to get approval for a life-preserving medicine for a disease that doesn't have many options.
That's pretty terrible. Obviously, this individual isn't somebody who can advocate for themselves in a very material way. Their options for interacting with other human beings is obviously limited. So clearly, this is a situation where it's going to be the easiest to take advantage of folks in this situation where they are preoccupied or they have serious health issues and are unable to advocate for themselves as well as others could.
Almost every other ALS patient I have met has a similar story to mine. We are already fighting a horrible disease. We shouldn't have to fight insurance as well.
The brutal killing of United Healthcare CEO Brian Thompson in December became a turning point in the public's growing frustration with the health insurance industry. Adding to the shock, the words inscribed on the bullet casings hinted at a motive.
The NYPD believe the gunman may have written messages on those casings. Officials say the writings found said, "defend, deny, and depose," which may potentially go to a motive for the shooting.
That issue of claim denials, it's been on the regulators' minds, Congress, and just patients themselves and doctors who are saying that's become an even bigger hassle in recent years than it has been in the past.
There are a couple of different ways that one might face a denial from their health insurance. One is prior authorization denial or insurer pre-approval care. So that might mean an MRI or CT scan. It might mean a more expensive prescription drug. The other type of denial that one might experience is a claim denial, which means that the insurance company is deciding whether or not that they are going to cover what you have already received. So this might be the experience of going to an emergency department and then getting a big medical bill because the insurance company decides that they didn't want to cover it. Prior authorization denial means that you're not going to get the care, whereas a claim denial might mean that you're facing big medical bills and medical debt, which can be really destabilizing for the patient.
Blue Cross and Blue Shield of Texas initially denied ALS patient Shelby Kinsey's medication, deeming it not medically necessary, a term insurers commonly use to deny claims.
Another reason why someone might be denied.
That seems odd to me. It feels like that could be an easy way to make this more regulated, is if the government had a curated list of medications that were medically necessary. Like, it seems odd that presumably every single insurance company here, because they were appealing Blue Cross Blue Shield in this case. So with that as an expectation and a baseline, every insurance company presumably manages their own list of what medications are medically necessary or not, and they can change it at any time with their own discretion. And so the easiest option seems like if the government just said these medications are matter-of-factly medically necessary, you can add extra things that you believe are medically necessary, but you can't go below this bar. Then at least that way they could basically reject any denials for that purpose. That seems like an easy path forward. It seems odd to me that every insurance company gets to choose on their own, and presumably there would be conflicts where maybe one insurance company does deem something medically necessary and one insurance company doesn't.
Is that the insurance company is saying that the prescribed care is experimental or investigational for the patient's condition.
CNBC contacted Kinsey's insurance provider for comment, but the company stated it, quote, does not discuss member issues with the media. Despite countless headlines and reports pointing to a rise in health insurance claim denials, the system's fragmented nature makes it hard to get an exact count.
It can be difficult to estimate exactly how many claims are denied in a given year by health insurers because not all health insurers report this data. But there are a few things that we do know. The Affordable Care Act did a few things to try to help make more transparent this really complex insurance process of coverage denials. One of the things that it did was it said that when insurance companies are denying you, they have to give you the reason and there's an appeal process. Another thing that the Affordable
That is actually a really awesome mechanism. I didn't realize that before, but them having to give you a reason already seems like at least you have something to go back on that you can like have a dispute on, and also the ability to kind of fight for that claim seems like a huge advantage for consumers.
Affordable Care Act did was it said that regulated plans had to disclose information about denials and appeals. But as is the story of a lot of American law and policy, a lot of this comes down to enforcement.
Using this limited data, KFF, formerly known as the Kaiser Family Foundation, published a study in January 2025, finding that 73 million out of 392 million in-network claims were denied in the U.S. in 2023. Also, Blue Cross Blue Shield of Alabama topped the list with the highest rate of in-network denial, followed by United Health Group.
There's a lot of misinformation bouncing around on the internet and social media platforms, and a lot of vitriol accompanying it. We support and pay 98% of all claims.
Most American workers are in employer-sponsored insurance, and those plans have not been disclosing this information, even though they're supposed to, but the enforcement has been lacking.
Health insurers are also using AI to process data, which some experts say leads to higher denial rates. Companies like United Health, Humana, and Cigna are facing lawsuits over using AI to deny claims.
Insurance companies have jumped right into this, and they're using this technology to do a lot more denials, a lot of inappropriate denials. There's some data that suggests that 25 to 30% of claims may be getting denied using AI technology. So it's a real challenge.
There are a lot of efficiency advantages. The problem is that there can be errors here, and we're not dealing with human beings reviewing these patient files. And we know that human bodies can be complicated, and people might present with the condition in one way versus another.
CNBC contacted the insurance providers for comment on AI being used to deny medical claims. Cigna said it does not use AI to deny care or claims, and Humana did not respond to requests for comment.
We do not use AI to tell our doctors how to care for patients, and we do not use AI to deny claims on the payer side. That's across the board.
Yeah, I mean, first and foremost,
This is also where like the term AI, I feel like, has so many definitions nowadays, especially in the AI boom in the last few years. Basically, everybody is trying to claim that what they do is AI, even though it would have just been standard algorithms or code 10 years prior. And so I think this is a situation where if you're trying to deny that you use AI, you can use this to your advantage of claiming that, like, no, we actually don't use AI, because they might just mean a very specific thing, like large language models, for instance, or they could mean some other generative AI system. And they're saying, no, we don't have that, versus something else. And so this is where we've been very loose with this term, especially because it's being used in like a marketing way. And it's kind of, I feel like it's kind of been taken away from its core initial definition. And so now that it's used as a marketing term, people are saying like anything could basically be AI. If you have a computer system that does anything at all that is reasonably useful, you could call it AI. And some companies are doing that. And so this is where if you want to push that your company is using AI, you could basically claim it if you have any software in-house. And also the opposite is true, which is because it's such a loose definition, you could say, no, I don't use those advanced AI techniques. I use something else that wouldn't normally be considered AI, but maybe would by certain companies. And so I think it's weird to say AI here just because I know what I consider AI, but I don't know what they consider AI. And that's what makes that a tricky statement.
Almost, I think we just need a lot more transparency. The fact that we don't know what proportion of claims are being denied is a huge problem. I think companies should be very.
Totally agreed. And they even stated earlier that they're supposed to be transparent about how many claims are being denied and that some companies just aren't doing this and it's not being enforced. This seems like a very easy way to get involved and add extra regulation, is to just enforce things that are clearly beneficial for consumers that isn't happening already.
Transparent about what are they denying, why are they denying it, if you're using AI, what models are you using. I think all of that would be extremely helpful. It would create incentives to build better models, and it would create incentives for people to be much more appropriate in how they do denials.
It's worth noting that most consumers are not appealing denied claims. In 2023, fewer than 1% did, and insurers upheld 56% of those appeals.
One thing that we've seen in surveying consumers across different insurance types is that they simply don't know that they have an appeal right. If appeals were used more often, it might operate as a check on carriers. From what we can see now, so few are appealed, so it's not operating as a check.
I wrote a book called Coverage Denied: How Health Insurers Drive Inequality in the United States. And I surveyed a little over 1,300 US adults and found that 36% of them had experienced at least one denial. Most of them experienced multiple denials. What I ultimately find is that people from lower income or minority groups tend not to appeal as much and tend not to ultimately get the care that their doctor has prescribed.
We are striving to make the process more consumer friendly because we do recognize that sometimes it's just hard, it's confusing, there's too much time, and if you're dealing with a serious health condition, there's a lot of anxiety and emotional distress that can go with that. So our journey as an organization is to make healthcare better.
The U.S. Census Bureau classifies health insurance into private and public categories. Simply put, private.
So they're about to go into scrutiny here. I'm actually appreciative that they had referenced the attack on the United Healthcare CEO, because this is something where I know that there's been a lot of heated debate on both sides of their opinions on this subject. Obviously, I would not encourage anyone to cause harm to any other human being, but I think this is something where this is getting attention because of that act. And this is where I think we should be asking ourselves, why did it take so long for us to draw attention to it? Like, this video that we're watching right now isn't likely reference to that event and themselves doing some scrutiny based off of the allegations that were brought up during that time. And so this is where, if that attack hadn't happened, we might not be seeing this video, people might not be digging into it as much. And so it's one of those unfortunate things where we can sometimes wait and let problems linger before we look into them. And especially for healthcare in the US, this is something everybody knows in the US. Like, people outside of the US know, if you were to ask any person from another country, especially ones with public healthcare, like, what's one of the biggest issues for the US, they'd say healthcare, hands down, like 10 out of 10 times. It is such a ubiquitous problem that people know about within our country and outside of our country, and yet somehow we still aren't drawing too much attention to it until these extreme events occur. And that's really disappointing for me. I feel like this is something that we should be talking about more, we should be getting more regulation on, and for some reason we still seem to be lagging behind in so many of these areas. Like, if we had proper regulation and some of these things were properly enforced, maybe that event never needed to happen. And that's the things that we should be doing now. We shouldn't be allowing things to fester until some people get so mad at whatever their personal circumstances are or whatever they're seeing around themselves that they lash out. And this is definitely a huge problem, and it's disappointing that, while I don't want to condone that event, that this event has actually spurred on the action that presumably it sought out, which was to enforce change and to create change in this environment. And again, that's really disappointing that those types of acts are the ones that potentially are getting the attention to actually create this change, whereas just advocating that other individual we saw at the beginning of this segment, that one barely got any attention. I would have never heard of that without this video, but I've heard about the attack through so many other avenues. And that individual is somebody who's suffering now and getting rejected for something that is going to impact their life. And we're just not mentioning it in the media, I guess. We're not talking about it. And so that person's story basically would have gone unknown to so many people, but the other story didn't. And so I think that's really a shame overall.
Insurance is funded through premiums paid by individuals or employers, whereas taxes and government programs finance public insurance. Private health insurance covers 65.4% of the population, while public insurance covers 36.3%. When it comes to private health insurance, United Health Group, the parent company of United Healthcare, is the leader. As the largest health insurer, United Health boasts a market cap of about $500 billion and holds 15% of the U.S. market share. In comparison, its competitors, Elevance Health and Aetna, each command 12% of the market and have a combined market cap of under $200 billion. Following the United Healthcare CEO's killing in December, investors closely followed the company's Q4 earnings.
Reporting earnings of $6.81 a share, beating estimates by 9 cents. Revenue of $100.8 billion was slightly below estimate.
Despite missing quarterly revenue expectations, if you look at the big picture, United Health Group's total revenue grew by 8% year over year, reaching a record $400.3 billion in 2024. United Healthcare, the company's insurance division, saw its full-year revenue rise 6% to $298.2 billion.
There are very few insurers in any particular market that control most of the market, so we call it an oligopolistic competitive market. If you look at United Healthcare, which is the largest insurer by far, the distinction is in addition to that oligopolistic power, they also have purchased and vertically integrated with physician group practices all over the country. They're providing physician bonuses to their own physicians to aggressively code things and then deny treatment if possible, if they can get away with it.
Frankly, part of...
Wow, that's actually really terrible that they are ingraining themselves as part of the medical practice and then basically rewarding doctors to not give as good of care as they possibly could otherwise. Like, that seems like that should be regulated ASAP. Like, that sounds like a huge issue, and clearly people know about it. Why don't our government officials know? Why aren't our lawmakers aware of this? And if they are aware, why aren't they making a change?
Transforming healthcare has been employing physicians who are focused on this concept of early diagnosis and intervention in chronic diseases. And so we do not own or operate hospitals. We focus on ambulatory health care and keeping people out of hospitals. And we employ fewer than 10,000 physicians today. By no means would we ever incent our doctors to deny claims or tee people up to have claims denied. That's just preposterous. We do have our doctors engaged in these value-based care models.
Of course, this individual who's representing the company is going to deny any wrongdoing. This is classic MO of any company of all time, even if they have already been caught red-handed. So this is where I don't consider these an appropriate counter argument. You can't have somebody at the company who would never, even if they've already been caught in some other situation, say that they're doing these things that are almost certainly going to get them in trouble if they admit to it. If they wanted to combat this statement, they likely should have gotten another individual who is a third party that is presumably less biased than this individual to offset those claims. I don't know, that's at least my opinion. I feel like using a representative from a company who is potentially causing the harm, they're obviously going to deny any wrongdoing 100% of the time. And so to me, this basically is like a false narrative. Like, we have to immediately discount this person's argument because they are very directly incentivized to portray the best version of what's happening. At least that's my opinion. I feel like they should have substituted this out or had this plus another individual who is potentially arguing on their case that is not incentivized to do so.
models, including Medicare Advantage. And for Medicare Advantage, it's important to document early any signs of disease. And let's just say something as simple as hypertension, making sure that blood pressures get checked, monitored, and if elevated, get addressed. That's just good medicine, right? There are financial incentives that are tied to our doctors who do a really good job identifying and treating chronic diseases.
United Health Group is posting record revenue and pleasing shareholders, while its insurance arm, United Health Care, faces criticism as the worst major insurer for claim denials. One study says it rejected about 1/3 of claims.
Right out of the gate, we pay 90% of claims. So 90% get paid right away. And another 8% turn out to be missing some important piece of information or something. So they sort of bounce around a little bit and they get adjudicated.
See, again, this individual, they just highlighted. They just showed the data. It's unclear where they got this data from, but this is where somebody is stating that they deny 33% of their claims, and their immediate reaction was, that's completely absurd. We're at 90% claim approval, which actually seems very high considering the statistics we've seen throughout this. It seems like basically nobody has a claim approval rate of 90%. I think they stated it was about 19% is the average denial rate across every company everywhere. So if they had less than half of the standard denial rate of a normal company, then they would actually be seen as the most generous insurance company. That'd basically be an impossibility in my mind for that type of distinction to be occurring. And so, again, this is where they're incentivized to say the best story, and it's not adding up. Again, I think it's reasonable as a news source to highlight somebody claiming the opposite, so that way you're not just getting one side of the story. But again, I wish we were using another third-party source for this instead of the individual themselves.
Of claims.
Right out of the gate, we pay 90% of claims. So 90% get paid right away. And another 8% turn out to be missing some important piece of information or something. So they sort of bounce around a little bit and they get adjudicated and paid. And then 2% ultimately do not get paid, which is relatively modest, and it's usually because a procedure or a desired care is beyond the scope of what either the federal government, the state government, or an employer has agreed is going to be covered by their insurance plans.
Honestly, when you look at United Healthcare as a company, it has probably more allegations of denial, wrongful denials than almost any other company. A lot of the testimony that you've heard already about United Healthcare is that profits before patients. The allegations, as I read about more of them, it's just extraordinary. It's got to be reformed. It's not only United Healthcare, it's all the insurance companies.
The U.S. healthcare system is a paradox. The U.S. spends more per person than any other wealthy nation, an astounding $13,432 in 2023, nearly twice the average, yet has the lowest life expectancy among comparable countries. Despite over 90% of Americans having health insurance, medical debt remains a pervasive issue, currently estimated at a minimum of $220 billion. This disconnect between spending and outcomes is further underscored by a recent Commonwealth Fund report, which ranked the U.S. health system.
Yeah, this is pretty terrible. Healthcare system performance ranking. So this is where U.S. is very ubiquitously known as having a terrible healthcare system. And so I think one of the key things here is to at least offset this a bit. I don't know if they're going to mention this at all, but from what I've heard in the past, it doesn't necessarily mean that we're incapable of having good healthcare. At least from what I've seen is that the issue stems from our health insurance and health coverage, which is people will not get the care that they need, or they will avoid care because they don't have the means to pay for that care. And so that drags our numbers down. Not that we are unable to care appropriately for those individuals. In some cases, I think where the care that they need is what they are given. In the US, we do rank pretty highly, but I think it's because of such high denial rates, the fact that so many people are avoiding care or not getting care at all when they need it, is what's leading to most of this problem.
Last among 10 high-income nations. On top of that, U.S. consumers are frustrated by escalating health insurance premiums.
We don't always have the best bang for.
Yeah, and again, this is where even that individual a little while back who was saying that they were looking into the allegations for United Healthcare, I think they referenced that that was happening sort of towards the middle of December. This, I believe, would have been after the attack as well. And so this is where they're even citing other sources that didn't really investigate this problem until after the attack. And again, this is where it's such a shame that we aren't looking into this. Presumably this individual wrote this book well before December. I assume that they didn't just choose a source who made a book after the attack, but they haven't really referenced the creation of that book. But this is where people are aware of this problem. It's not like if you don't go looking for it, you can't find it. We are just being willfully ignorant or blind to this issue.
Buck when we look at population health outcomes. And so there are a few different reasons that account for the high health spending in the United States, despite not having universal health coverage. One is that we have a lot of reliance on private insurance, which spends a fair amount on administrative costs relative to just direct patient care.
If one looks at the cumulative increase in the cost of family health insurance premiums between 1999 and 2023, that increase is 314%. And a good portion of that is not being covered by an employer. The workers' contributions have actually increased over that time 326%. Those increases are...
Yeah, I'm just going to leave that there for a moment, just because how outrageous some of these numbers are. So again, just to quickly go through those, the bottom line, the green one, is inflation. So this is where we expect if every cost was specifically in line with inflation, it would be very close to this green line. The next closest line that's right above that is earnings for workers. And so it slightly outpaces inflation here. And so that's a good thing. And then there is the top two lines, which are the premiums for health insurance, which are over 300%, and then the actual contributions by the workers, which exceed 314%. So this is where they're referencing for it to be higher than the average increase means that on average, employers are paying less over time in this same time frame. And so this is quite outrageous. I think over this time frame of about 1999 to 2023, inflation is just above the 50% mark here. This likely excludes the most recent data that has it shooting up quite a bit. And then actual income is just over 100%. So this is where it's growing at basically 3 times the pace of what you'd expect your wages to be in, and about 5 times as much as inflation itself.
Dramatically higher than the increase in workers' earnings over this time period. The cumulative increase in workers' earnings is only 111%. And so workers are seeing a substantial increase of their paycheck going towards covering their health insurance. Now, when people see those disparities, they blame a lot of the difference on health insurance companies. They think health insurance companies are the ones that are enjoying all the profits resulting from these dramatically higher premiums. It actually turns out if one looks at the price data, one finds that between 2006 and 2023, hospital prices have actually increased 180%.
Okay. So this is good information here that they're actually highlighting. So it's interesting that, again, they spent so much time basically pushing blame onto insurance companies. And then here they're sort of pulling it back a little bit and saying that actually the hospitals themselves are the ones who are increasing the prices the most in this scenario. So this is where health insurance costs do noticeably go up. And it would make sense that pricing went up noticeably around COVID, presumably in this case. That's slightly after 2019 in this graph here. And then basically once COVID was essentially over, it sort of dropped back down. So this seems to make sense. So this is where hospitals themselves seem to be taking the most advantage of this scenario, and we haven't really talked about them at all up until this point.
4%. Physician prices have increased 138%, and insurance prices have increased, but they've increased only by 128%. And that's because when you take the cost of health insurance and you net out the cost of the underlying healthcare, health insurance prices have not increased as much as they have for hospitals.
Widespread frustrations with health insurance are reflected in a recent Gallup poll, which reveals that views on healthcare quality have dropped to a 24-year low. Many, including United Health Group CEO Andrew Whitty, agree that the healthcare system needs reform.
United Health Group CEO Andrew Whitty writing a piece in the New York Times today about what he calls the flawed healthcare system in America.
The folks are paying more and more for coverage of which they know less and less about, and which is more and more complicated. So if I buy coverage and all I'm getting is a denial, then you question the value of the product that you have purchased or your employer has purchased for you.
CNBC reached out to major health insurers and AHIP, the National Trade Association for Health Insurers, for comment on claim denials and the healthcare industry. AHIP stated that health plans, providers, and drug makers share responsibility for making care affordable and easier to navigate.
Healthcare in the United States is very fragmented and very expensive. These are true problems that we need to air and discuss. It's awfully easy to find somebody to blame, right? Oh, let's blame health insurers. Most people don't know that health insurers are actually administering plans with rules made either by the government or by employers. We need to actually bring down costs of healthcare. Too many procedures are done in very expensive settings that could actually be done in outpatient settings at much lower price points and help bring the cost of healthcare in the U.S. down.
As discussions on claim denials continue, former NYC consumer...
So at least what he said there sounded fairly reasonable. I think, again, the hardest part that I'm having right now is how much data he mentioned that they showed contrary information to already prior to that last statement. And so while I want to believe it, I think there's been too many things that he said that appear to be false at face value that it's hard to assume that that is the correct information there in that last statement. So maybe they'll share it, but we're getting towards the end of this video, so maybe not.
Consumer Affairs Commissioner Bruce Ratner highlights the potential solutions.
It probably would require an act of Congress to do that, to require that, in fact, you have to post or you have to disclose your denial rates.
Right.
It can be done by the states. I don't think it's likely to be done by the Congress, frankly. It's the correct kind of system. You need something against the other side. And against the other side would be publishing denial rates so that we choose our company based on denial rates, and that makes the companies work very hard to be competitive.
I wish insurance companies would treat each case like the person they are instead of just another number. I believe that healthcare should be accessible to everyone and less focused on making a profit. At the end of the day, these companies are supposed to help us, not make things worse.
Thank you for watching. If you've enjoyed what you've seen, please hit like or subscribe. I will see you around.